Hepatitis B. Definition. Hepatitis B is a serious liver infection caused by the hepatitis virus. For some people, hepatitis B infection becomes chronic, meaning it lasts more than 6 months. Having chronic hepatitis B increases your risk of developing liver failure, liver cancer, of cirrhosis, and condition that causes permanent scarring of the liver. The most people infected with hepatitis B as auto-recovery fully, even if their signs and symptoms are severe. Infants and children are more likely to develop a chronic hepatitis B infection. A vaccine can't prevent hepatitis B, but there's no cure if you have it. If you're infected, taking certain precautions can help prevent spreading hepatitis B to others.
That is seen during blood test, yung tinatawag natin hepatitis serology. Kasi merong mga tinatawag tayong serologic markers for hepatitis B infection. So how will you know kung fully recovered ka na? Once you get the infection in the adult stage, 95% spontaneously recover from the disease. Meaning, patient becomes infected at a certain point in time. 6 months after, when you check the serology, patients lose the surface antigen. They develop yung tinatawag na antibody to the surface antigen or anti-HBs. So, pag yan nakita mo na 6 months after in somebody who got the infection in the adult stage, resolved hepatitis B infection yan. Immune na siya for life. The problem is when you get the infection at birth, meaning vertically transmitted from mother to child. 95% are chronic carriers for life. Okay? Only 5% spontaneously recover. So, hindi na mawawala yung HBs antigen sa dugo. Kahit taong-taong mo yan ipagawa, dahil nga naging chronic carrier na sila since birth, it will always be positive or reactive when you do the blood test. So, these are the patients who will become carriers indefinitely. But, some of them may recover also. No? So, napakahirap pag nakuha mo during birth. Mas better if you get it in the adult stage.
The symptoms: abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin and the width of your eyes. Causes: sexual contact, sharing of the needles, accident needles stick, mother to child. Application is in nursing. Regarding the diet, it should be normal fat, normal protein, and normal caloric. Keep personal use objective insulate for the other health people. Perform concurrent disinfections with soap and water and finish with some chemical sanation. Take precautions with blood and body secretions, protecting hands with gloves when handy. Administrate bed vaccine for those who are the risk of contacting the disease virus. Conclusion: it is prevented by the vaccine against hepatitis B that is in the national vaccination schedule. In additional, infection can be prevented by using a condom for all sex, not sharing needles or other sharp items.
For those living with patients with chronic hepatitis B, I always advise them to be screened. Because once one member of the family is reactive or positive, all the siblings, the family members have to be screened because for all we know, baka nakuha nila sa mother nila nung pinanganak sila. Considering that hepatitis B infection, majority have no symptoms. That's why yung karamihan sa nakikita natin, they were only discovered through pre-employment screening. pupunta ng abroad, overseas workers, seafarers, OFWs. Doon lang nila nalalaman na meron sila because it was required. The test was required. The screening was required. So, doon sa mga kasama sa bahay, there's always a chance for them to acquire the virus. Because kasama mo sa bahay, you can always share your razors, toothbrushes, anything that gets in contact with blood. Nasugatan yung kasama mo, ay natalsikan yung sugat, pwede pa rin, no? So, always screen. Have yourself screen. And then, once screen, then that's the time that we can address the problem.
Treatment: antiviral medication, interferon alpha 2B, liver transplant.
Hepatitis B is an infectious disease. Particularly in its chronic form, it is associated with severe suffering and even death. The outcome of an infection with hepatitis B virus is determined by the individual immune response. If this is insufficient, chronic hepatitis B develops. After HBV has entered a liver cell, genomic HBV DNA is transported to the nucleus, where it is converted into covalently closed circular DNA. This cccDNA functions as the template for the transcription of several viral messenger RNAs. These are exported to the cytoplasm and then either translated into viral proteins or packed into nucleocapsids and converted back into viral DNA. A newly formed virus is released from the cell, as is the hepatitis B surface protein, detectable as HBs antigen in the serum. If the patient's immune response is inadequate, the virus can proliferate. Among other viral markers, serum levels of both HBV DNA and HBs antigen rise. The HBs antigen level is an important diagnostic parameter. Persistent HBsAg levels are associated with increased risk of HCC. Clearing HBs antigen and/or seroconversion is closest to a cure in the treatment of chronic hepatitis B.